Myth: big leg veins always pop back open after heat ablation. Data: not so fast. I'm looking at a massive US registry, Vascular Quality Initiative, tracking real-world varicose vein care from 2015 to 2019. Nearly 17,000 thermal ablations of the great saphenous vein, small saphenous vein. And here's the twist: they split veins into small, large, with large being 10 millimeters or more in diameter. So does bigger mean doom? Short answer: no. On the outcomes that actually matter, whether the vein stays closed, large veins did not do worse. In fact, in the time-to-event analysis, large diameter wasn't linked to poorer recanalization-free survival. The odds ratio was 0.74 with a p-value of 0.24. Translation: no statistically significant signal that big veins reopen more. But what about side effects? There were small bumps. Large veins had slightly higher rates of hematomas, 0.7% versus 0.4%, and superficial phlebitis, 1.5% versus 0.8%. That's real, but still low in absolute terms. For the rest of the post-op complications they checked, no meaningful differences. Here's the surprise I didn't expect. Symptom relief was actually a touch better in the big vein group. Using the standardized Hasty scale, heaviness, achiness, swelling, throbbing, itching, large veins improved by -7.47 points versus -7.01 in smaller ones. Statistically significant and clinically encouraging. Let's zoom out. This wasn't a tiny case series. It's 13,000 plus patients and 16,937 procedures in everyday practice. And the conclusion is clear. Large diameter, 10 millimeters and up, was not associated with worse recanalization after thermal ablation. So if you've heard your veins too big, it'll just come back. That's the myth. The data say thermal ablation can still be a first-line option, even for big saphenous veins, while keeping an eye on those slightly higher but still uncommon minor complications. If you're considering treatment, ask your clinician about your specific anatomy, closure technique, and follow-up plan. Evidence evolves, but today's best read is simple. Big doesn't automatically mean bad. Stay curious.